They are offering free screenings for the next 2 weeks. Just take advantage of this offer. Call and make an appointment in Sicklerville, 856-728-1900, Woodbury, 856-853-0988, Washington Township, 856-374-3707, Pennsville, 856-678-8000, Vineland, 856-794-8300, and in Swedesboro, Logan Township, 856-467-9911. Want to thank our guest, Dr. Mark Pollard, for joining us. He is with the Cooper Bone and Joint Institute, located in Camden, Cherry Hill, and Voorhees, also Newtown Square, Pennsylvania. Also want to thank Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Don't forget, we'll be back a week from tonight with another edition of Sports Doctor. And until then, I'm Joe Chapana. Oh, wait, they're telling me we won't be back till January. So we'll talk to you in January. Until then, I'm Joe Chapana. Stay well.
Inner Realm Designs is a South Jersey graphic design company that is dedicated to providing high-quality design services to companies of any size. Graphic design, print design, web design. Look us up on the web at www.irdesigns.net.
Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
Something's going on. And something is going on here at Sports Doctor. That's what it is. We come your way every Thursday night. Tonight we're brought to you by Cross Keys Physical Therapy. Tell you what's going on there. They're offering free screenings for the next 2 weeks. They're located in Sicklerville, Washington Township, Woodbury, Pennsville, Vineland, and Swedesboro. We'll give you the numbers to take advantage of that free screening offer. Right now, though, we want to give you our toll-free number to reach us with your questions. Tonight we're going to be talking about general sports injuries, so we'll run the gamut. Our toll-free number is 1-888-634-7488. Answering your calls tonight, we're pleased to have Dr. Charles Krome. He is a non-operative sports medicine physician. He's with the Rothman Institute, sees patients in the Voorhees and Egg Harbor Township offices of Rothman. Next to him is Dave Anselmo. Dave Anselmo is a physical therapist and also the owner of Cross Keys Physical Therapy. Again, general sports injuries tonight. Our toll-free number, 1-888-634-7488. Dave, lead it off with the anatomy of the back.
Let's bring this up here. This is anatomy of the vertebral column here. Let's go to the top. Cervical spine, there's 7 cervical vertebrae, which are the blue here. This is a thoracic spine. There's 12 thoracic vertebrae. And then here in the blue, we'll turn a little better here. This is the lumbar vertebrae, and there's 5 here. And then we got the sacrum and the ilium here. And in between here, you got the discs and the nerve roots that come out. The spinal cord comes back. Let's get a little deeper here into it. We'll get closer here. This is the vertebral vertebrae. As you notice up top, they're thinner, and as you go down, they get thicker. And that's because of weight bearing. The lower down, the more weight bearing you have, the thicker the vertebral body gets. So here's the lumbar spine here. I take this off, and here's the disc. Okay, and the disc here, I explain to my patients that this is very much like a jelly donut in the sense that there's a jelly-like material inside it. It's called a nucleus pulposus. If I put pressure on the front of a jelly donut, it's going to move the jelly back posteriorly. That's very similar to a disc. Now, fortunately, this disc has an annulus fibrous ligament that goes around this, and it's very tough material, and it will hold the content of that fluid inside that disc. But unfortunately, there is a weakness. Everything has its weakness point, and this disc is posteriorly and laterally. As you can see on this model here, posteriorly and laterally, as it comes down, that's exactly where the spinal cord comes up. You see it right here, and the nerve roots exit on both sides. And if you have a problem where you're doing a lot of, which we'll be talking more about tonight, you're doing activities where you're leaning forward a lot and pushing that disc posteriorly, it could hit on the nerve and create something called a bulging disc or a herniated disc, which I think the doctor's going to talk nicely about.
Yeah, what about this, Dr. Krome? Bulging disc, herniated disc, slip disc, are these all the same things?
Well, Dave, actually, these terms do refer to the disc that Dave was talking about. If you could just hand me that model over there with the, we'll use that analogy of the jelly donut a little more clearly on this model. So we'll take this one first. This model right here shows, again, as Dave said, you've got the nucleus pulposus, which is the jello-like material inside the disc and acts as a shock absorber. When you refer to a herniated disc or a slip disc, it refers to this material kind of pooching out the back and impinging on a nerve. So that's a herniated or slip disc. A bulging disc is going to refer to the disc material being less herniated or less protruding than a herniated disc. So a bulging disc may cause more back symptoms, back pain, things like that, whereas a herniated disc that's actually impinging on a nerve root is going to cause more neurologic symptoms such as pins, needles, numbness, tingling, usually radiating down the thigh, depending on the distribution and at what level that disc is herniated.
All right, general sports injuries is our topic. We welcome your phone calls. Our toll-free number, 1-888-634-7488. While we're waiting for your calls, let's talk about poor sitting posture, Dave. Why is that so important to correct?
Well, poor sitting posture is very important to correct. Like I mentioned earlier, I didn't mention earlier, this is the normal curvature of the spine. There's a cervical lordosis here, and then there's a lumbar lordosis, which is a curvature like this. We want to maintain these postures. This posture is where the spine is mostly best supported by the muscles, tendons, and ligaments. Once you go out of that posture and deviate from it, then you start putting stress on these structures. And only, like anything else, the muscles, tendons, and ligaments only can withstand so much. And then the pressure will go onto the disc and create what they call a bulging disc first, or back pain first, then, which is a warning. I tell people that when they have pain, pain is our body's way of telling you something's wrong. Don't just ignore it. It's telling you something's going wrong. So address it, find out what's going on, go see your doctor, and let them find out what's going on with it. And like I said, it will lead to a bulging disc, which also, if you don't correct that, it can lead to a herniated disc.
And Dr. Krome, what do you think are the more frequent causes of low back pain?
Well, there's usually in my practice or a general sports medicine orthopedic practice, most of the causes are usually what we term idiopathic or unknown. I have tons of patients that come in and I say, well, what did you do to your back? And they say, nothing. It just started hurting me out of the blue. But a lot of times we do see athletes who will strain their back. We can see stress fractures in the back. We can see bulging discs, herniated discs, things like that. So there's a variety of causes. Some people cough or sneeze. They wind up bulging a disc or herniating a disc. Other people are lifting heavy objects. I have construction workers or people that do manual labor for a living that just frequently have degenerative discs that over time, 30, 40 years of doing hard labor, they frequently wear out the disc material. The discs don't last forever, just like the rest of our bodies. The discs, as you continue to bear weight, people who are overweight, things like that, athletes, linemen who put a lot of stress on their low backs, these lumbar discs or even discs in the thoracic and the cervical spine will just basically deteriorate and degenerate over time. This will cause a significant amount of pain. I would say degenerative disc disease is probably the most frequent cause of pain in my practice.
All right, our toll-free number is 1-888-634-7488. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. We're talking general sports injuries tonight. Our first caller from Wilmington, Delaware, I believe, Regina. Oh, I'm sorry, from Newark, Delaware. Regina, go right ahead with your phone call on Sports Doctor.
Hi, Doctor. Yeah, my husband had his back operated on in December of 2005.
Okay. And how's it going?
The back operation went very well.
Good.
He had a disc repaired, removed. Okay. He has no more back pain.
Good.
But he has lost the use of his legs.
Okay.
You mean he can no longer walk? Is that what you're saying?
Yes, he was in a wheelchair, then a walker, and now a quad cane.
Okay. How old is he?
69.
69.
What's your question?
The question is, could the back operation have anything to do with him losing the use of his legs?
Well, that's not really a question that I can answer. I would best talk to your surgeon or someone the surgeon that did the operation would probably best answer that one.
But we certainly...
Yeah. It sounds like he was walking after he had the surgery. It sounded like it got worse as he went on. Is that correct?
She still there?
Regina?
He did.
Yeah. Well, was he able to walk after the surgery?
No.
He never got out of the wheelchair after the surgery then?
Well, he got out of the wheelchair. Okay. He can walk with a cane or the walker.
Okay.
Did he have a lot of
He has a lot
neurologic
of pain
symptoms?
nighttime, daytime, and his kneecaps are frozen cold.
Did he have a lot of nerve damage prior to the surgery?
Not that I know of, no.
Well, I mean, the best thing, there are some tests you could do, such as an EMG, which is a nerve test that will tell if there was nerve damage. Certainly, that would be a test that one could order. Also, sometimes, if there's scar tissue from the surgery, that could be pinching on some nerves that travel down the legs, and that could cause problems as well. So, you can't really say whether or not the surgery caused the problem. Without looking at his MRIs and examining him and things like that, it would be hard to make that decision.
Regina, we wish the best to your husband, and we thank you for the phone call, and we thank you for watching. Our toll-free number is 1-888-634-7488. We're talking general sports injuries tonight. We'll take your phone calls. Lines are open. We're taking a short break. We'll talk to you when we come back here on Sports Doctor.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Hey there, it's Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. They are offering free screenings for the next 2 weeks. They have locations in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. Throughout the course of the program, we'll put up their numbers. If you want to take advantage of that free screening offer, simply call them and make an appointment. Simply call us tonight as we talk general sports injuries. Our toll-free number, 1-888-634-7488. Answering your calls, Dr. Charles Krome. He's a non-operative sports medicine specialist with the Rothman Institute. Next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Okay, I believe we got Judy on the line from Spring City, Pennsylvania. Judy, if you're there, go right ahead with your question.
Yes, hi. I just have a question in reference to I have 3 herniated discs in my back, and I'm having radiating pain down my leg with numbness in my left foot, and now it's in my right foot. And I just was wondering if this pressure on the nerve could cause permanent nerve damage.
Ah, that's a good question.
That's a good question, Judy. The answer is certainly, yeah, it could, depending or how long that pressure has been there. My recommendation, if your symptoms are that bad and you're noticing a progressive neurologic deficit, you should probably call your orthopedist or neurosurgeon as soon as possible, get in to see him or her. I don't know if you've had an MRI or what evaluation you've had, but certainly I wouldn't mess around with that. Also, if you've noticed any change or loss of control of bowel or bladder function, that's an indication that you've got a real serious, what we call neurologic emergency, and you definitely would need to be seen immediately for that. So I wouldn't mess around with that.
Judy, get that checked out. Thank you for the phone call. Our toll-free number, 1-888-634-7488. Okay, Brad, we've got in Easton. Brad, go right ahead with your question on Sports Doctor.
Yeah, my wife hurt the back of her leg, and I'm assuming it's her hamstring.
Okay.
And she's been complaining for a long time, a couple weeks now, that it's not getting any better. And I was wondering, and now her other leg is starting to hurt. I was wondering if, that's a hamstring injury, or how long does muscles take to heal?
Okay. If it is a hamstring injury, how long?
Well, did she injure it? Was she running or sprinting or doing something to injure her hamstring? Or
We don't really know how she hurt it.
Well, it could be a hamstring injury if she was running or performing a sporting type activity, or the other thing would be something like a sciatica where she's getting some pain or inflammation of the sciatic nerve. The sciatic nerve travels down the. We'll get to our model here in a sec. Travels down the back of the buttocks, or deep in the buttocks, and down the posterior thigh region, then down the back of the leg and innervates the feet. And so it could be a sign of a herniated disc or inflammation of the sciatic nerve, and so that's something I would definitely get checked out.
All right, Brad, thank you for the phone call. We wish our best to your wife. Our toll-free number is 1-888-634-7488. General sports injuries. Let's talk to Carl in Cherry Hill. Carl, welcome to Sports Doctor. What's your question for us?
Slight herniation in my in L5. I don't really get pain radiating down my leg, but I do get some relief from almost trying to do splits or stretch my legs out. I've tried physical therapy, but the pain hasn't really gone away. I'm contemplating doing shots now. What are your thoughts?
Well, that's a good point. Usually we start our evaluation and management of someone with your similar problem with start with conservative management. We can ask Dave about what he would do for someone with your problem. If physical therapy, core strengthening, anti-inflammatories, maybe a short course of some steroids doesn't help, heat and the like, then the next step would be to go to the epidural injections. Before I would let somebody do that, though, I would certainly go with a good physical therapy program, and Dave can elaborate more on that.
Yeah, I think it's real important, first of all, take advantage of our free screening we have. You can close to many of our offices. Really need to be evaluated to figure out really what it's coming from. Is it really coming from the herniated disc? It doesn't sound like it is to me, because usually if you have a true herniated disc, you have constant pain that doesn't stop, and it doesn't sound like you're having that. So we know, in general, there's people that can go get an MRI today and might have 6 or 7 herniated discs but are asymptomatic. So not necessarily because you have a herniated disc means that that is causing your pain. There's a lot of other ways a lot of other functions, things that can be causing this. A bulging disc could cause it, like a sciatica, impingement, piriformis syndrome. There's so many different things. You need to be evaluated and get narrowed out to find out what it could possibly be. And then we can better assess you and tell you what we need to do to get this better. Aquatic therapy is one of the other options. I know you said stretching is very important, and you need to be stretched appropriately. So all these things need to be accounted and find out what's going on to best assess what's going on with you.
And if you want to take advantage of that free screening offer, Carl, you're in Cherry Hill. I believe Washington Township would be close to you, possibly Sicklerville. Look for the number there on the screen and just take advantage of that free screening offer. Call, make an appointment. It's as simple as that. It's Sports Doctor. We're brought to you by Cross Keys Physical Therapy. Let's talk to Bill, is it, in Wildwood? Bill, go right ahead with your question on Sports Doctor.
Yes, my question is, I have a herniated disc, and it's really bad, burning so bad. I just can't sit or stand. I have to lay on the couch.
Okay.
Someone recommended spinal decompression treatment, and I understand it takes weeks for the treatment. But my question is, should I just jump in and get this thing operated on? Because I can't take the pain anymore.
Dr. Krome is shaking his head now.
Yeah, I definitely wouldn't jump into any operation for anything. I mean, I would always, get an opinion by an experienced physician who takes care of these type of problems, and then get a second opinion. And certainly, if anyone is recommending surgery as a first-line treatment, I would certainly absolutely go seek a second opinion. Again, the way I practice, the way we practice at the Rothman Institute is really start with conservative management first, pretty much for any injury unless it's absolutely necessary. If you've got a large herniated disc causing a progressive neurologic deficit where the person is got this pins and needles, numbness and tingling, weakness in their legs, loss of control of bowel bladder function, things like that, a foot drop, things like that are getting worse and worse, that's probably your only indication for spine surgery. But just a normal run-of-the-mill, or not run-of-the-mill, but a normal herniated disc, really, you'd start with a lot of the treatments that Dave was mentioning, and again, anti-inflammatory medications. People will try acupuncture, things like that. That can also be beneficial. So I certainly wouldn't jump right into surgery unless it's absolutely necessary.
All right, Bill. Thank you for calling. Our toll-free number is 1-888-634-7488. We're talking general sports injuries, and Ray is our next caller. He is from Cape May. Ray, go right ahead with your question on Sports Doctor.
Yes, I've hurt my shoulder about a year ago, and I feel like I pulled something or torn something. The problem is I had a triple fracture in my cheekbone many years ago, and I have wire. It was wired together, and I can't get an MRI. So what would be the procedure to find out if there is damage there?
Okay.
That's a great question. First of all, I would check and see if you can get an MRI, because that may not be entirely true. The only indication I know that you can't have an MRI would be a pacemaker. So you may want to check on that. The other thing is, if you can't have an MRI, certainly I would start with some routine x-rays, and before I went and tried MRIs or CAT scans or anything else, I would try some conservative things like physical therapy for rotator cuff, scapular stabilization exercises, things like that, because patients come in and all they talk about is, well, we need an MRI, let's get an MRI, let's get an MRI. But I can treat most problems without MRIs, just with plain x-rays and a good physical exam and a good history, and really MRIs are just used to confirm diagnosis. So patients need to really not get so caught up on getting MRIs. They really need to worry about, or the physicians need to worry about doing a good history and a good physical exam. And usually the MRI just kind of confirms things before we go ahead and try to think about surgery. Usually MRIs are reserved for cases where people fail conservative management, and you're thinking about sending a patient to a surgeon just to confirm what you suspect is your diagnosis. So don't get caught up on the MRIs.
It used to be all x-rays not that long
Right,
ago. I mean,
exactly.
that's the MRI's a fairly recent thing.
And we practiced medicine without MRIs in the past, sports medicine and orthopedics before MRIs too, so we can do stuff without MRIs.
All right, our toll-free number, 1-888-634-7488. All right, Summers Point, Jenny, we have Jenny on the line. Jenny, go right ahead with your question on Sports Doctor.
Thank you very much. I'm a failed back surgery patient.
Okay.
And I'm told that I need to have another surgery, and now they want to go in from the front, from the back, take all the hardware out and redo everything. And I guess my main thing was, if I didn't fuse the first time, what makes me think I'm going to fuse the second time? What would my chances be?
Well, that's a great question. Unfortunately, no surgery is ever guaranteed to be 100% successful, so I'm sorry that you didn't have a good result. What I would probably do is get a couple opinions before you decide to rush off for another surgery. The spine surgeons at Rothman are probably some of the best in the country, if not the world. So certainly Dr. Vaccaro, Dr. Hillerbrand, Dr. Albert, Dr. Arnold, those guys are all the tops in their field, and Dr. Ponapan. So I'd recommend coming to see one of the spine surgeons at Rothman before you went off and had another surgery.
And of course, this underscores what we've been talking about earlier, the importance of conservative approaches before surgery, because nothing's 100% with surgery.
Right. Exactly right. So
Jenny, we wish you the best. Our toll-free number is 1-888-634-7488. We need to take a short break. When we come back, we're going to talk to Bob in Blackwood, I believe, and also take more of your phone calls too. General sports injuries tonight. Don't forget Cross Keys Physical Therapy offering that free screening. You need to take advantage of that. Call one of the centers near you. They're in Sicklerville, Washington Township, Woodbury, Pennsville, Vineland, and Swedesboro. There are the numbers on the screen. We're coming back with more of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
I will be.
I will be. I will be.
I will be a pro.
A professional athlete.
A gold medalist.
If you want to be a pro, then train like a pro. Hi, I'm Mike Quick, and I've joined the Velocity Sports Performance Team powered by the Rothman Institute. The highest levels of competition require more power, more speed, more agility. Here at Velocity, we train athletes of all ages and skill levels in these specific areas. Come in for a free training session and see how you can maximize your potential.
All right, this is Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. They have locations in Sicklerville, Washington Township, Woodbury, Pennsville, Vineland, and Swedesboro. They're offering free screenings. Just call them and take advantage of that free screening offer. Make an appointment. That's all you have to do. You can call us now with your questions. General sports injuries, 1-888-634-7488. I believe, is it Bob from Blackwood? Is that it? Bob, go right ahead with your question if you're still there on Sports Doctor.
Yes, doctor. Thank you for taking my question. I've been dealing with bulging disc, herniated disc, degenerated spine for the last 20 years. I went through several shots, series of shots in different years, physical therapy. I think you name it, I tried it. Now, the only thing the doctor is leaning towards now, the orthopedic surgeon, is surgery. And my question is, if there is surgery, I guess there's a couple different types of surgery. We didn't discuss in detail. But my question is, I'm 51 years old. If I did have a type of surgery where, like, they freeze the disc or they immobilize the disc because I have a degenerated spine at this point also, is there any chance for, like, exercise for...
Yeah, I guess he wants to know if he can get a positive result.
Sure, yeah, there is, definitely. After you have something like that, you really need, if you have degeneration, if they do a type of surgery, after the surgery, we work diligently in getting your range of motion back, and most importantly is stabilizing that spine. I think that's probably what they're going to do, is talk about possibly a fusion, but you need to strengthen the musculature that surrounds the spine. The corset muscle, you hear the core muscles. This is your abdominals and your back extensors. You really need to work those muscles to support the spine and take the pressure off that spine. There's no reason after having that surgery that you won't be able to return to do some good exercises, but you need to be instructed and make sure you're doing them properly and not creating